it is clearly emerging now that COVID-19 is different from SARS. It is different in several ways. First, the transmission mechanism of COVID-19 is different from SARS. In fact, the transmission mechanism is closer to H1N1 or influenza. And our own researchers, our own people at the National Center for Infectious Diseases, looking at the cases within Singapore, have confirmed this. Because like influenza, they have found that COVID-19 is infectious when the symptoms are mild. So this, and because of this, because of this transmission mechanism, it is also the case that COVID-19, like influenza, can spread quite quickly. Because with our mild symptoms, we sometimes let our guard down. We continue going out even though we don't really feel well, and that's how the virus transmits. So that's the first point, that the transmission mechanism of COVID-19 is closer to H1N1. The second point is that in terms of severity, COVID-19 is also different from SARS, and we've said that before. If you look at the mortality rate in China, overall it is lower than SARS. Outside of Hubei province in China, it is even lower. Outside of China, it is low too. So mortality rates are lower than SARS. If you look at the severity of the disease, various studies are being done now, but the WHO has a very comprehensive one of 17,000 patients, and they found that 80% of the patients have mild symptoms, 82% have mild symptoms, 15% have severe symptoms, and 3% have critical symptoms. So that's quite a large study based on 17,000 patients. So it is not a mild illness at all, but certainly not of the severity of SARS. So these are the facts that we know about COVID-19 today, right? It is less severe and it is more infectious than SARS. It is different from SARS. And that's why, because of the higher degree of of infection, various experts have also projected that the disease may well spread at a much faster rate, closer, more akin to H1N1. A Harvard study looked at airline travel volume, and they concluded that the virus may well have spread undetected to various countries in the region, including countries like Indonesia and Thailand. That's from the study. Public health experts in various places, in Hong Kong and the University of Florida, there's one person in the Florida University who's also the advisor to the WHO, concluded that the numbers of people infected with this virus outside of China cannot possibly remain at current levels. It will eventually rise, and it's a matter of time before you see a lot of people around the world getting the disease. So to give this some perspective, if you look at H1N1 and the flu pandemic in 2009, 10 to 20% of the global population contracted the illness. In Singapore alone, more than 400,000 people got ill from H1N1 in less than a year. We are not saying that this will happen for COVID-19. It's a different disease than H1N1, so the patterns of transmission and the number of people contracting the disease will be different, but because the transmission patterns are similar to H1N1, we should be prepared for a scenario where you get wider transmission around the world. At this stage, as we have emphasized, if you look at the number of cases we have, if you look at the number of cases around the world outside of China, at this stage, there is no widespread community transmission of the virus in Singapore. There is no widespread community transmission of the virus in any country outside of China. All of us are doing everything we can to reduce the risk of further spread of the virus. We are doing this in Singapore. Other countries are doing the same. But this is a fast-changing situation. We are getting new information every day, and we are learning more about the virus every day. And as we get more of this information, we will share it with everyone so that everyone is informed and updated of the latest understanding of this virus, and we will also reassess and update our strategies to deal with this evolving situation.